access to healthy nutrition in sustainable ways. Our consumer health division is increasing accessibility to self-care products and empowering consumers to take charge of their health. In pharma, we provide more access to new innovations that address conditions that are important and today underserved. Finally, in crop science, offering holistic solutions to support productivity and reduce environmental impact. And as you'll hear more about today, we're also partnering to address equity and access. Bayer is investing in the CDC Foundation's Alliance for Million Hearts campaign, an initiative to prevent 1 million heart attacks and strokes within 5 years, particularly focused on increasing access for people of color who are disproportionately affected by heart disease. We see the opportunity to leverage Bayer's scale and resources to address issues of health equity and access. But we know that no one organization has all the answers. It's going to take multiple organizations across private, public, and non-profit sectors working together. And that's why we're thrilled to be hosting today's session, the first in our Health Equity Collaboratory Series. Today, I'm joined by an outstanding set of panelists, Dr. Lisa Wardell, the Chief Medical Officer at the CDC Foundation, Dr. Elizabeth Ofili, Board Chair of the Association of Black Cardiologists, and Al Mitchell, President of the Bayer Fund. To begin, each panelist will introduce themselves and provide their perspectives on advancing health equity and access to improve heart health in the Black community. So Dr. Wardell, let's please start with you. Please tell us about yourself and the new campaign launched by the Alliance for Million Hearts.
Well, Patrick, thank you so much for having me today. It's certainly my pleasure to be here on behalf of the CDC Foundation with my esteemed colleagues from other organizations. And we congratulate you on this collaboratory that you are hosting today, and glad to be a part of this discussion. First of all, as a physician, I certainly over the years have cared for a number of patients who have experienced significant consequences of cardiovascular disease. And personally, like many families, particularly African-American families, I've been personally impacted and family members as well. So this is a very real issue and a serious issue, particularly impacting the Black community, as you've already mentioned. By way of background, I am a preventive medicine and public health physician with over 30 years of local, state, and national experience, having worked in local health departments, both urban and suburban and rural settings, having been in significant roles at the state health department, having worked with a couple of nonprofits around chronic health conditions, policy and programmatic issues, as well as maternal and infant issues. And we certainly know issues around cardiovascular health, particularly issues around hypertension, have a real impact on mothers of reproductive age and both in the prepartum and postpartum period. And so, you know, working on these issues is something that I'm really passionate about, and the numbers speak for themselves, with the cardiovascular disease rates in the country being so significant and certainly having worsened during the pandemic. So when we think about these issues, we know that they're really complex. And so the foundation is really excited that with the help of Bayer, that we've been able to convene this public-private coalition to support the Million Hearts Initiative at CDC, with the overarching goal of preventing 1 million heart attacks, strokes, and cardiovascular events. We know that this campaign is focusing on helping people really understand their personal risk and to believe in the power that they have the ability to change these things and to take steps to lower the risk. We've done a couple of campaigns to start small, live big, and most recently launched the Live to the Beat campaign that was just launched last week, that really focuses on particularly the African American community. It was informed by the community and helped to design by the community, and really is talking about what are those actionable small steps that you can take where we're really focusing on living. So Patrick, I'll stop there, and I've got a lot more I can share, but I'm sure you'll come back to me.
Thank you very much, Dr. Waddell, and I will be coming back to you. You're right. We're really honoured in Bayer actually to be your partners in the Alliance for the Million Hearts. We think it's a fabulous initiative, and thank you for the good partnership. Next, I'd like to welcome Dr. Ofili. Please tell us about yourself, Dr. Ofili, and the work you're doing to ensure representation in clinical trials.
Thank you so much, Patrick. And my name is Elizabeth Ofili. I am a professor at Morehouse School of Medicine. I practice cardiology with Morehouse Healthcare here in Atlanta, Georgia. And I am very pleased to be a part of this, representing also the organization Association of Black Cardiologists, where I serve as chair of its board. So as a preventive cardiologist, I have much similar experience as Dr. Waddell shared. So our practice, in addition to a multi-specialty practice with Morehouse Healthcare, we also take care of patients at Grady Health System, which is pretty much the largest health system that serves many underrepresented. So we have predominant African-American patients, certainly Latinx population, and we see the types of health disparities that you, Patrick, with your organization Bayer, as well as the CDC Foundation and the Million Hearts work, really trying to get to control. And so I am just delighted to be a part of this, to share some of the work that we've done and also share what we see as opportunities to begin to drastically reduce and minimize the impact of heart disease, especially in Blacks. I will also share that being a preventive cardiologist, I do see, the disparities related to especially high blood pressure, congestive heart failure, heart attacks happening at much with African Americans that are much younger for both men and women. And that is really what led me and several colleagues at Morehouse to come up with a model to try to help people, empower them to manage their health. And we believe that you need this type of engagement with doctors who take care of these patient populations, but also specifically speaking with the patients to understand the issue of health literacy, because just because people are educated doesn't mean they know about their health condition. And the mistake we've made in medicine for the longest time is to assume that a 5-minute consultation will solve the patient's chronic health condition. And so you've got the public health component, the CDC Foundation driving the Million Hearts I want to say March, Million Hearts campaign. And then you've got doctors in their offices that have to see patients and lots of patient schedule. So you need to begin to think about what happens outside of that doctor's office that can help that patient manage their chronic illness. And I look forward to sharing some of our experiences that I think is really changing how patients exist with chronic illness, especially heart disease. Thank you.
Thank you, Dr. Ofili, and for all the work that you do. Finally, let's hear from Al Mitchell. Al, please tell us a little bit about yourself, the work of the Bayer Fund, and how we're using that to address health equity and access to nutrition at the community level. Over to you, Al.
Great. Thanks, Patrick. And I'm honored, actually, to participate in this discussion. As Patrick mentioned, my name's Al Mitchell. I'm currently Vice President of Corporate Engagement and President of Bayer Fund, leading our philanthropic and community engagement efforts in the U.S. I actually started my career in finance with the Legacy Monsanto Company, holding many roles, including general auditor and assistant controller, before moving into this position 6 years ago. With regards to this topic, let me first say, unlike my two other esteemed panelists, I'm not a doctor. So this is not a professional perspective, but one whose experiences include the time spent in this role addressing these issues, and also as a person raised in an urban community that has had limited access to healthy and nutritious options. So let me start out by saying, while there are a multitude of contributing factors to healthy outcomes for people, including genetics, economic status, and systemic racism, it is clear that it is inextricably linked to access to a nutritious diet that includes access to fresh fruit and vegetables. And as you look at under-resourced communities, they're less likely to have this access. In fact, there was a study done and published in 2018 by Reinvestment Fund that said almost 18 million people live in areas with limited supermarket access. And across the country, it is disproportionately impacting low-income communities and people of color. When you live in this type of community where you don't have the income nor the transportation necessary to gain access, you tend to make decisions that lead to unhealthy practices like resorting to fast food, or you depend on other entities that can help. It's compounded with the lack of access to education around the impact of nutrition and the lack of access to quality health care. And you get, as a result, generations of unhealthy lifestyle that is difficult to break. Now, with that as the background, this is exactly why Bear Fund attempts to be another vehicle to provide these resources to these communities. Over the past 5 years, we've invested more than $120 million to address food insecurity, STEM education, and health issues centered on cardiovascular and cancer support. Last year alone, we provided over $8 million, supporting more than 380 food banks, pantries, and other organizations providing healthy and nutritious food or addressing cardiovascular disease and cancer. That's across 46 states, over 940 cities and counties, reaching more than 1.7 million people, primarily in underserved communities across rural America, St. Louis, northern New Jersey, Berkeley, California, and our Pittsburgh regions. Now, I'll share a couple of examples of some magnificent programs that is trying to address this very topic we're talking about. I'm happy to include that our support of the Alameda County Community Food Bank's Farm Fresh Produce program, which produces and procures fresh produce and distributes it through their network of partner agencies serving households that are predominantly people of color, households in which 20% of them have a member with diabetes, households in which 39% of them have a member with high blood pressure. And utilizing and providing them access to these healthy and nutritious foods, we think goes a long way to helping them manage these chronic diseases. On the healthcare side, there's two organizations that we recently launched programs with, the American Heart Association and the YMCA of Greater St. Louis, in which we provide healthcare providers and patients in the most underserved areas with proven tools and best practice for improving their blood pressure awareness, treatment, and control, and including providing them blood pressure cuffs in order to do a lot of self-monitoring. So we have a lot going on. I'm excited about this category. I'm excited about the impact that we're having and looking forward to continuing it. Thanks, Patrick.
Thank you, Al. That's a lot of great and important work, and thank you for your dedication to it on behalf of us at Bear. So it's been great to hear each of your introductory perspectives and a little bit of background on the work you're doing. But Dr. Wardell, I'd like to turn to you for a moment. As more public attention is focused on addressing health disparities, what do you think is most important for people to know and do?
Well, thank you again, Patrick. And wow, Al, that's a lot of great information. And certainly this whole piece around literacy, Dr. Ofili, that you mentioned is so incredibly important. You know, one thing that I think when we're thinking about and talking about this piece around equity and what people can do, I think it's important to sort of step back and recognize that cardiovascular disease has a lot of complexities and disparities have a lot of complexities. And there are a lot of things that contribute to the high rates and the disproportionate rates that we have around cardiovascular disease and deaths. And one of those issues is access. And there are a lot of nuances, if you will, and complexities to access. There's, do I have access to insurance? Does that insurance actually cover preventive services as well as treatment? Now, when I have access to that insurance card, do I actually have providers in my community that accept that insurance? Do I have the transportation to be able to get to that healthcare professional's location? And And then do we have challenges around the biases that are inherent in the system? And do people understand those biases that they may have and how that might be impacting the care that I'm providing? Am I informed enough to feel like that I can advocate for that access that I need? Then we've got the access around the nutrition, the healthy fruits and vegetables, right? The access around a safe place to practice physical activity. So there's so many complexities to the issue around access that contribute to health disparities. So I think when we're talking about the issues around health equity, it's important to understand the issue, important to understand the complexities of the issue, and to recognize that it takes a lot to sort of move the system. And it really takes a systems approach and all of the partners and the collaborators to weigh into all of the nuances and things that need to be addressed. From a corporate sort of perspective, then it's important to think about what are the policies, right? So have I looked internally to my organization, as you've already mentioned, Patrick, about making sure I've got a diverse and inclusive workforce? But do my policies allow for paid time off so that persons can actually go and get the care that they need, access that care? And have I use the opportunities to educate around biases? I think it's also an opportunity to say, what is sort of my overall sort of corporate social responsibility? And we know, we've seen it during the pandemic, the importance of community-based organizations and the critical role that they play. And so what's that opportunity to make sure we engage in community-based organizations and helping to support those organizations, because they are representative of many of the people that we're really trying to reach. So those are a couple of the things that I wanted to share regarding equity.
Thank you, Dr. Waddell. A lot of great perspective. Dr. Ofili, from your interactions with patients, what would you say are some of the most important factors that need to be addressed in terms of ensuring health equity and access when it comes to cardiovascular disease particularly?
Yes, thanks, Patrick. So first, let me just say the whole systemic approach that Dr. Waddell shared is critical, and certainly acknowledging the work that Al and the team at Bayer are doing to get to the grassroots at the level of the community and what people need. So when we come to the healthcare system where I work, what we've learned is, as I was alluding to in my introduction, that 5-10 minutes of engagement with the patient doesn't begin to get them to what they need for the next 3 to 4 or 5 months of managing their chronic illness before they come back in. So we do, as we know, the health system has some of these things. You go to see a dietitian here, you go to see some other nutritionist, and patients are expected to pull all of this together with the 2 or 3 or 4 chronic conditions that they're dealing with. So we thought one way to get around it, although I'm a cardiologist, I was struck early on by the numbers of patients with diabetes that are part of my practice, as well as patients that have just difficult to control blood pressure. Now, I'm not talking about the heart failure, the heart attacks, which are typically the purview of a cardiologist, but you've got these other disease conditions that are part of the what gets referred to us. So, that led us to come to think about how can we empower patients to be able to self-monitor, learn about their health, and not feel intimidated when they go into the doctor's office to say, hey, doctor, what's been going on with my body for the last 3 to 4 months before I came in to see you? Here's what's happening with my glucose. Here's what's happening with my physical activity. Here's what's happening with my blood pressure. So then we spend that 5-10 minutes in consultation talking about what I brought in, not just how are you doing? Fine. Your medicines, are they good? Yes. And bye. I'm not exaggerating. 5 minutes is just too short. So what happened with that is Morehouse School of Medicine as I said, a group of us, we came up with this technology and, was approved for a patent, and it's now out there. We've distributed it to church communities like Big Bethel AME Church, to primary care doctors' offices, and really thousands of patients have used it. And we've shown that a patient does not have to be a nutritionist or a diabetologist or a physician. They understand their body. And if we just empower them and give them the help of a health coach, because that's the other thing we provide as a part of it, people can learn about themselves and be involved. Patients really want to understand more about what's the good foods that I should eat. As Al was saying, providing good nutrition, where to find it, knowing how to estimate calories, so you know how to balance. We don't want you to just eat what you don't like, but there are ways to prepare the foods you like so it's good for you. So we do all of that. And then ABC got involved because we set up what's called a cardiovascular implementation study. It takes patients with heart disease, but also high blood pressure, diabetes, and all the comorbid conditions within a physician's practice. Member practices of the Association of Black Cardiologists, they got together and they decided this is something that we can share with our patients to help them improve their health. It's called Health 360X. And while they work with it, COVID happened, and it turns out that they could do remote engagement with their patients using this platform. And so patients felt connected inside and outside of the doctor's office. So we're very excited that obviously this partnership is growing, and quite frankly, very grateful that the NIH has done a fast track to accelerate getting this to more patients and physicians through what's called a small business innovation commercialization with AccuHealth Technology. So full disclosure and shameless plug, that's the organization we founded to help get this important technology in the hands of many patients. And right now, patients download it for free. They don't have to pay anything, but they do need to engage with their doctor so they can get this bidirectional monitoring and response to their health. So that's one way that we're helping, Patrick.
Well, it's a big help, and it's very exciting to hear about it. And again, if we can be any part of supporting that, expanding that, this is exactly the type of systemic, self-informed approach that people need. So it's great to hear. It's very inspiring to hear, and it's what's needed. So thank you for sharing that.
Sure.
Al, as you work with community organizations, and you touched on this, really focused on addressing health disparities, what are some of the best practices that you've seen and you recommend that others can learn from?
Well, great question, but I will give the great doctors a lot of credit because they hit on many of the elements that I see as I'm out there and my team is out there trying to find partners that we can provide funding for to initiate programs to address this topic. First and foremost, what I've found is within the community, you have to find the partner that the people trust. One of the things that I think is a barrier for us, in addition to just having and lacking access to health care, is someone that they trust, that when they're providing information, they truly believe in it. So that's one thing I found. It's got to be a trusted partner. Secondly, I think you have to have strategies, and we look for programs that have different strategies to address the different constituents within that community. I come from a certain generation. You got millennials, you got all kind of folks sitting in urban communities, and their experiences and their education and awareness about this is at different levels. You have to find the right strategy to be able to address that group of folk that you're trying to change within a very effective strategy and program. Secondly, we can't simply talk at people and simply provide awareness. And the doctors hit on this. We have to address the underlying barriers, which include education, awareness, but also there are tools and resources that are needed that many can't afford, that we have to help them be able to gain access to that. And that's blood pressure kits and diabetes, glucose monitoring machines, and then professionals that they trust that can help them, especially in diet. I mentioned it earlier. when you come from a generation or you come from a certain environment and you develop habits, just like most people, it's very, very difficult to break those habits. As a person of color, I'm afflicted with diabetes and high blood pressure. I know, at least from a high blood pressure perspective, some of the things that are causing it. But the way I was raised, the environment I was raised, it is so hard for me to break them. It really is. And so we need to provide the tools to help people break through the barriers that have been built up over years. And here's a great example. It is not a community program, but it's one that we try to emulate as we go out and fund nonprofits. And I give Bayer kudos for this, because this company offers all its employees an opportunity to join a program called One Drop. And I recently joined One Drop. And I got my free glucose monitoring kit. I got my blood pressure kit. And I have a coach and counselor that I talk to every day when she sees elevation on either my blood or my coach. And we look at ways in which I can help better monitor it without completely changing my diet. So it's those types of programs, those types of relationships I think are important if we're really going to make a change and reduce cardiovascular disease, especially with people of color.
Thank you, Al. And obviously, it's great to hear about that program in Bayer. And I hope our entire organization is using that. Now, before we close, and I'm conscious of time, I did have a final question that I'd like to get just some quick perspective on, starting with you, if that's okay, Dr. Wardell. Really, what do you see as the opportunity for public and private sectors to work together to better address these disparities we've talked about in health equity and access? Would love your top line thoughts.
Yeah, absolutely. So, I mean, so much of what we've heard today are the types of things that Bayer is doing and others can do to really help work together on this. I want to acknowledge what I've heard that, this is hard, right? It is hard for folks. And I think that's part of what we heard and we incorporated in the Live to the Beat campaign, that this is hard, but that these small steps that people can take, tools and tips by going to livetothebeat.org, are things that people can do. And so the kinds of things that corporations can do are to continue to help with these types of campaigns where there are small actionable steps that can help build that confidence and belief that folks can make a difference in their own lives, to give them a voice, to feel empowered to influence those kinds of systems change, and to really help those community-based organizations and programs like the ones we've heard today on the ground that are touching people every single day make a difference.
Excellent. Thank you, Dr. Wardell. Okay, well, we're just coming up to our time. I wish we had a lot more time, but I do want to thank our panelists, Dr. Wardell, Dr. Ofili, and Al, for the wonderful work you're doing, the difference you're making, and for sharing your time and perspectives today. Thank you so much. And thanks to all of you for joining us virtually and participating in this important dialogue. We could have spent many more hours on this discussion, and we absolutely must do so. I think Bayer is in a unique position to advance equity in health and nutrition, and we have a responsibility to do that. I personally am committed to building on our efforts to make meaningful and substantive impact on the communities where we work, where our customers live, and who we serve. This is the first in our series of health equity collaboratory sessions. We hope you will join us for our next discussion, where we'll take a much closer look at advancing access to nutritious food, which has been mentioned literally half a dozen times today and is critical to improving the health of the nation. In the meantime, please continue the dialogue by sharing your thoughts and comments and any questions you'd like us to follow up on the LinkedIn Live page. Thank you, stay well, and thank you so much once again to our esteemed panelists. All the very best.
Thank you.
Thank you.
Thank you.